Hey friends, let's discuss depression, a feeling or a suffering. But before that, just let's look at the shlok that I've given away here. Ashato ma sadgamaya, tamaso ma jyotirgamaya, mrityorma mamrutangamaya. From ignorance, lead me to truth. From darkness, lead me to light. From transience, lead me to permanence. What is depression? Well, if you Google it, you'll find this definition that it's a mental health disorder characterized by persistently depressed mood or loss of interest in activities causing significant impairment in daily life. According to other websites, you'll find that it's a serious medical illness that negatively affects how you feel, the way you think, and how you act. While some others will say you that it's a common medical condition. It causes a low mood that doesn't go away and makes us feel very sad or withdrawn. It interferes with the way we go about our everyday life and can make it hard to cope. I'm feeling low. Is it depression? Well, before answering this question, let's see what are the symptoms of depression. You have depression when you have 5 or more of these symptoms for at least 2 weeks. A depressed mood during most of the day, especially in the morning. You feel tired or have a lack of energy. You feel worthless or guilty. You have a hard time focusing, remembering details, and making decisions. You can't sleep or you oversleep almost every day. You have no interest or pleasure in any activity. You often think about death or suicide. And friends, this is the reason why treating depression becomes so important. You must get your loved ones or yourself out of depression. You feel restless or slowed down. You have lost or gained weight. You may also feel irritable and restless, lose pleasure in life, overeat or stop feeling hungry, have ache or pain, have sad, anxious or empty feelings. Well, friends, depression symptoms can vary from mild to severe. It also includes loss of energy or increased fatigue, increase in purposeless physical activity, or slowed movements and speech, feeling worthless or guilty, difficulty in thinking, concentrating, thoughts of death or suicide, like I've already said. Friends, a very important thing in depression is that medical conditions like thyroid problems, brain tumor, vitamin deficiency, they all can mimic symptoms of depression. So it's important to rule out general medical causes. Depression is different from sadness or grief or bereavement. The death of a loved one, loss of a job, or the ending of a relationship are quite difficult experiences for a person to endure. It's normal for feelings of sadness or grief to develop in response to such situations. Those experiencing loss often might describe themselves as being depressed. But being sad is not the same as having depression. The grieving process is natural and unique to each individual and shares some of the features of depression. Both grief and depression may involve intense sadness and withdrawal from usual activities. But still, these two are different in many important ways. In grief, painful feelings come in waves, often intermixed with positive memories of the deceased. In major depression, mood or interest are decreased for most of 2 weeks. In grief, self-esteem is usually maintained. In major depression, feelings of worthlessness and self-loathing are common. For some people, the death of a loved one can bring on major depression. Losing a job or being a victim of a physical assault or a major disaster can lead to depression for some people. When grief and depression coexist, the grief is more severe and lasts longer than grief without depression. Despite some overlap between grief and depression, they are different. Distinguishing between them can help people get the help, support, and treatment they need. Who can suffer from depression? Depression can affect anyone, even a person who appears to live in relatively ideal circumstances. Several factors can play a role in depression. Firstly, biochemistry. Differences in certain chemicals in the brain may contribute to symptoms of depression. Genetics. Depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the illness sometime in life. Personality. People with low self-esteem who are easily overwhelmed by stress or who are generally pessimistic appear to be more likely to experience depression. Environmental factors. Continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. Now the question comes, how is depression treated? Well, medication, of course. Brain chemistry may contribute to an individual's depression and may factor into their treatment. For this reason, antidepressants might be prescribed to help modify one's brain's chemistry. These medications are not sedatives, uppers, or tranquilizers. They are not habit forming. Generally, antidepressant medications have no stimulating effect on people not experiencing depression. Antidepressants may produce some improvement within the first week or two of use. Full benefits may not be seen for 2 to 3 months. If a patient feels little or no improvement after several weeks, his or her psychiatrist can alter the dose of the medication or add or substitute another antidepressant. In some situations, other psychotropic medications may be helpful. It is another It is important to let your doctor know if a medication does not work or if you experience side effects. Psychiatrists usually recommend that patients continue to take medication for 6 or more months after symptoms have improved. Longer term maintenance treatment may be suggested to decrease the risk of future episodes for certain people at high risk. Psychotherapy or talk therapy is sometimes used alone for the treatment of mild depression. For moderate to severe depression, psychotherapy is often used in along with antidepressant medications. Cognitive behavioral therapy has been found to be effective in treating depression. It is a form of therapy focused on the present and problem solving. It helps the person to recognize distorted thinking and then change behavior and thinking. Psychotherapy may involve only the individual, but it can include others. For example, family or couple therapy can help address issues within these close relationships. Group therapy involves people with similar illness. Depending on the severity of the depression, treatment can take a few weeks or much longer. In many cases, significant improvement can be made in 10 to 15 sessions. Next method is electroconvulsive therapy, ECT. It's a medical treatment commonly used for patients with severe major depression or bipolar disorder who have not responded to other treatments. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. A patient typically receives ECT 2 to 3 times a week for a total of 6 to 12 treatments. ECT has been used since 1940s and many years of research have led to major improvements. It is usually managed by a team of trained medical professionals, including a psychiatrist and anesthesiologist and a nurse or physician assistant. If you find anyone suffering from depression near you, then it's your duty to help them come out of it. Do your duty well. Thank you for listening to this video, and do share, subscribe and like this video, and remember, spread the message of depression wherever you can, because the more aware we are about this disease, the more safer we are from this disease.